Welcome. You are seeing the first multi-procedure vaginal surgery simulation training model. It features lifelike skin texture and highlights all the important surgical anatomic landmarks, particular for vaginal surgery. Procedures able to be performed are vaginal hysterectomy with or without bilateral salpingo-oophorectomy, transoperator midurethral slings, both the outside-in approach and the inside-out approach, retropubic slings, both the top-down and the bottom-up approaches, and bilateral sacrospinous ligament suspension. There is a pressurized vascular system for the uterus, tubes, and ovaries, and an inflatable bladder. The surgeon will be able to do a full-thickness vaginal wall dissection and hydrodissection, as well as clamp, cut, and tie vascular pedicles. All operable parts are replaceable, and the main pelvic frame is reusable, making this a highly cost-effective pelvic surgery training model. Notice the lifelike skin texture, which allows for easy palpation of surgical landmarks such as the obturator fossa and pubic tubercles. The model can be placed in Trendelenburg and reverse Trendelenburg positions, and it can also be rotated to the left and right. The uterus is a replaceable cartridge and slides easily into two pre-cut grooves into the pelvic sidewall. The uterine cartridge can be easily inserted and removed. The vaginal cuff apex will taper down and form a very snug fit around the cervix. This will function as the anterior and posterior cul-de-sacs on palpation. Shown here is the endopelvic fascia attached to the vaginal wall, which extends to the sidewall of the pelvis bilaterally. The bladder is also a replaceable cartridge. It rests in the retropubic space and is attached behind the pubic symphysis. It also features a thin wall which allows it to be filled with saline, and if damaged will leak water. The uterine cartridge is specially designed to have a pressurized vascular system. Notice the two holes at the top of the broad ligament are specially fitted to accept standard IV tubing, which will mimic blood supply. The replaceable vulva is attached by three fasteners, one on each side and one posteriorly at the sacrum. This allows for easy removal and reattachment. This is the inferior view of the pelvis, and shown here is the arcus tendineus fascia pelvis terminating into the ischial spine. This is raised for easy palpation through the vaginal wall. The obturator membrane and muscle pops easily into the sidewall of the pelvis. It secures and is anchored in place by these two grooves shown here. The anterior surface of the sacrospinous ligament has palpable ridges. The sacrospinous ligament is secured to the sacrum using snaps, and it also snaps into the pelvic sidewall at the level of the ischial spine. The pelvic frame removes easily from the support stand. A simple support design allows for easy assembly, adjustment, and compact storage. The Miya model is versatile and highlights anatomic landmarks essential for vaginal surgery. It creates a realistic surgical experience that can enhance any level of surgical training.